How do we manage hypotension in a patient of ARNI? Hypotension in a patient of ARNI is usually seen in the early stages of heart failure in a drug-naive patient. For example, any patient who has been recently diagnosed with heart failure where the ejection fraction is less than 30, patient hemodynamic compromise like blood pressure is 90/70, patient has crepitations, heart rate is fast. All these patients are initially managed with diuretics. And because of diuretics, there is volume contraction. And that's the reason why once you start a ARNI, you will have precipitous drop in blood pressure. In such situation, you need to make sure that patient is not volume depleted. He should be having adequate volume, not volume overloaded. So adequate volume could be assessed by IVC diameter by ultrasound. If the IVC diameter is good and normal and it has a normal collapse during respiration, in that case you could easily start with 50 mg twice a day dose. And if lungs are clear, in that case you can reduce the doses of diuretics, because presence of SGLT2 inhibitor in such patients also works as a diuretic and that's the reason why loop diuretic doses can be reduced in these patients. So easily what I could suggest is the initial starting dose is very important. Diuretics has to be reduced, volume of a patient should be assessed if there is a hypotension, and if hypotension goes to levels which are deranging the patient's serum creatinine and potassium values, then you have to withdraw the drug. If the serum potassium goes more than 5.5 or serum creatinine goes more than 1.8 or eGFR declined by 30% from the baseline, then that is the right time where you should withdraw the drug, try to hydrate the patient properly and restart the drug. So that's how you need to manage this patient of ARNI and hypotension in the initial phases of heart failure. Thank you.